Hi, my name is Dr. Oscar Tamez. I'm with Tejas Ear, Nose, and Throat, and this is a video going over the medical treatment for chronic sinusitis and allergic rhinitis after I have assessed you and that we have determined together that you have a nasal sinus issue. So we are going to discuss the treatment here in the office, but this video is for you to go back to if you need to. If you have any specific questions, we want to make this as simple as possible and as convenient as possible. So one of the treatments is 21 days of an antibiotic, and it's a very benign antibiotic, but as we discussed in the office, I'm not a big proponent of antibiotics. But the standard of care is 21 days of antibiotics before we can move on to offering any other treatments. And there are patients who develop enough satisfaction with this medical treatment that they are satisfied. And as long as you're happy, I'm happy. So 21 days of an antibiotic, you always use a probiotic with those antibiotics to preserve the good gut bugs and to reduce any complications from antibiotics. We're also going to recommend a nasal rinse. You use any type of saline, over-the-counter saline bottle, and one that's bigger that you can carry in your pocket is even better. But this is just a twice-a-day regimen. The way you do it is you uncap it and you take off the little nozzle, and then the antibiotic is an ointment called Muprosin, which will be written as a prescription. And so you unscrew the cap, and then you put, and it doesn't have to be perfect, a dime size or a nickel size of this in there. You put the nozzle back on tightly, put the cap back on, and now you shake it. And you can use this same bottle and shaking it in between uses or before a use, and you can keep the same thing until it runs out, and then you just refill it. You can either get another bottle, or you can refill this bottle with distilled water, and you can add a little of pickling salt or the salt that comes with any Neilmed bottle. And then you just cap it and do it again. We want you to do it for about 4 weeks. And the way it works is after you've shaked it, you put it up to your nostril, and then you go, tilt your head a little bit, and you go 2 sprays in each nostril twice a day. And we want you to do that for about 4 weeks. Once you're done with that, now we're going to introduce an allergy nasal spray, which is going to reduce inflammation. So this ointment and the saline reduces inflammation in your nose and sinuses. This this allergy nasal spray called Flonase, which is a nasal steroid spray, which just stays in the nose and is completely safe. And so you're going to go, for an adult, you're going to go 1, 2, 1, 2, once a day. For a child, you're going to do 1 spray once a day. It's nice to have it there in your sink, next to your sink, to have this whole regimen, and that way you don't forget, and you don't have to carry this along, as long as you're doing it twice a day. So now we've given you an allergy treatment, we've given you an inflammation reducer in the antibiotic, and we've given you the antibiotics by mouth. And that is considered medical therapy. I will see you back in about between 4 and 8 weeks, and at that time, you will decide, did the decongestant test that I gave you in the office make a big difference in your breathing? Did this medical therapy that I prescribed you and treated you with maintain a significant improvement that you're happy with? Because if you're happy, I'm happy. Thank you for entrusting your family to Tejas Ear, Nose, and Throat.